Do you know that there is a new test called the cervical screening test? The cervical screening test replaced the Pap test because the new test is better at finding out if you might be at risk of developing cervical cancer in the future. Cervical cancer is found on the cervix, which is inside your body at the top of your vagina. The new test looks for the human papillomavirus in your cervix. You may have heard people call this virus HPV. This is the virus that can lead to cervical cancer. Lots of people get HPV. Anyone who has ever been sexually active could have it, but do not worry, the body usually clears it up by itself. If HPV does not go away on its own, it can lead to cervical cancer, but it usually takes about 10 to 15 years for this to happen. Having the cervical screening test is important because it checks to see if you have HPV before it becomes a problem. Women between the age of 25 and 74 should have the cervical screening test every 5 years. You may have had or heard about the Pap test. It's done the same way as the Pap test was done. Some cells are taken from your cervix and sent to a laboratory to be tested to see if you have a HPV infection. You should book in to have a cervical screening test when your next Pap test is due. If you have never had a Pap test, then you can book in for a cervical screening test today. We know you might be feeling embarrassed or scared about having this test, but doctors and nurses do this test all the time. Also, if you would feel most comfortable speaking in your own language, you can have an interpreter come in for your appointment, or you can talk to one on the phone.
You can have a cervical screening test at your GP, a Family Planning New South Wales clinic, or at a women's health clinic. You can ask for a female doctor or nurse to do the test. For more information on the test, you can visit the Family Planning New South Wales website or call the Family Planning New South Wales talk line for free and confidential advice. If you want to speak to someone in your language, you can call the Translating and Interpreting Service and ask to be connected to Family Planning New South Wales talk line. Talk to a doctor about the cervical screening test today.